I'm Sunil Nandra. I'm a psychologist in SLAM's Early Intervention Services, and I've been one of the site leads for the EYE2 study in London. So we know that engaging young people in early intervention services is a key part of our role. We have interventions that we believe can be successful. We know we can support people to work towards improved quality of life and much better outcomes. But in order to do so, we need to support young people to stay with our team, to help them feel safe to be with the team and help them to feel like our interventions are acceptable. And so to have a project which is dedicated to the task of engagement is just a fantastic way of progressing our work. So if we think about the booklets that the study has provided, fantastic resources for information about types of experiences young people may be having, information for carers and people in the person's network, information really accessibly put together around key issues like medication. Many young people have concerns about medication, what it might mean for them to be on medications like antipsychotic medications. So to be able to provide accessible information around some of those key issues is really important. And then EYE2 has also come with a program of sort of social support for the young people who are referred into our teams as well. So we've been lucky enough to work with people with lived experience who've put together social groups for young people to attend. And that, rather than being a kind of technical intervention, is a way for young people to come together to listen to and hear about other people's experiences. And we often feel, even when we're talking about therapy groups, for instance, that those non-specific aspects of hearing someone else's story, recognizing the ways in which they might be similar to my story, can be really powerful. We're aware that when family members and service users have been offered this type of information, that's been received really well. And so I guess that's in keeping with the fact that people are keen, understandably, to be as well informed about the nature of their care as possible and to have the greatest number of choices about their care as possible. So when care coordinators are better armed with these kinds of materials to be able to offer that to their clients, I think we can expect that does tend to be received really well. It also means that rather than being reliant on particular conversations with professionals, families and young people themselves can have something to go away with, to kind of digest and think about in their own time, and then come back to the team having thought about what they might want, and to be in a stronger position to be able to make those requests. I think the other thing would be that no one is kind of complete in their knowledge and their understanding of an area like early intervention. And so for any clinician, however experienced, there's going to be information in the booklets that they may not have been aware of and may not have been comfortable with previously. And so it's a fantastic set of resources for carers and young people themselves, but for the people working in the services too. So if you think about an example like the completion of key outcome measures, that's something that teams historically have really struggled with just because of the volume of work and the number of other tasks that are required. But when there are dedicated staff within the team, so these were the research workers with EYE2, it becomes a little bit more part of the routine and the culture of the service to operate in certain ways. And I think that gives the opportunity for a kind of lasting effect.